Hi, friends. 55 years old female contacted me because on ultrasound, 5 millimeters gallbladder stone was discovered. She went for consultation to a surgeon, and the recommendation from the surgeon was, let's plan a surgery 4 months from now. Laparoscopically, we will remove gallbladder and the stone. And in the meanwhile, it's a good idea, he said, to go on very low fat diet, no fat diet, because you will prevent formation of the stones. And it's important, more important, when you eat fatty diet or fat in your diet, the gallbladder will contract and bile will start to move. And with the bile, the stone will start to move and may obstruct the flow of the bile, and you will have an acute episode. So, person had 2 questions for me. Question number 1, is this correct that if I will go on very low fat or no fat diet, I will prevent formation of the stones? And the answer is no. And the question number 2, is this correct that if I will go on low fat diet, then I will prevent acute episode? And the answer is kind of. Research shown that people who eat high-fat meals will have a higher chance to have more pain, meaning the stones will start to move because gallbladder will start to contract. However, you have to kind of keep in mind, it's a very tricky question because here's the deal. When we eat fat, the fat gets into our digestive tract and it's a signal for the gallbladder. Fat is here, start to contract. Gallbladder contracts, bile gets released. Yes, with the bile, stone will move. However, if you is not going to eat fat or low-fat meals, the gallbladder is not going to contract. As a result, the bile will be staying there inside. The water will get absorbed and the bile will become very concentrated. And because it's concentrated, the stones will start to form. And in this particular case for the patient, she already has a small stone there. And the bile will become concentrated, and the stone will become a center, precipitation center, and the stone over the time will become bigger. So you can see how it's very difficult to navigate. You can have it's a good idea not to eat a very fatty meal, but on the other hand, you cannot not to eat fat. So what did I recommend to this person? And here is my recommendation. I told her that it's actually a good idea to eliminate simple carbohydrates out of your diet, bread, spaghetti, cookies, candies, cakes, ice cream, soft drinks, juices. So because they will contribute to formation of the stones, and I will explain why. And here on the right, you see what I actually recommend her to eat. So you need to eat bad and good fat, but do not eat very fatty meals. So you don't cause violent contractions of the gallbladder, but still keep good fats such as avocado, fish, nuts and seeds, cheese, and egg, and incorporate also meat into your diet. Now, somehow people and medical community assume that if, by the way, 85% of the gallbladder stones are cholesterol stone. The people assume that if it's cholesterol, it means that this cholesterol because I eat fat. So they assume that low-fat diet will be good. And the correct answer is no. The actual fat in your diet has no effect whatsoever on cholesterol stones in the gallbladder. Now, let's go and look who actually have a higher chance to form cholesterol stones in the liver. Let's go to different medical websites. Now, let's go to Johns Hopkins Medicine website. Who are going to form gallstones? Here we go. Obesity is a major risk of gallstones, especially among women. Estrogen from the pregnancy, hormone replacement therapy, birth control pills, increase cholesterol level in the bile, and decrease gallbladder motility. So motility, if gallbladder is not contracting, then more gallbladder stones will be formed. Ethnicity, Native Americans. Gender, females, probably because of high level of estrogen. Age, people over 60, unfortunately, tend to form more stones. Cholesterol-lowering medications. Just Google in 1 second. Here's the answer. Short-term use of statins associated with higher risk. Diabetes. People with diabetes generally have level of fatty acids called triglycerides, which increase the risk of gallstones. So you can see diabetes and obesity. Who tend to have obesity and diabetes? Are those the people who eat more fatty diet? No. Those are the people who eat high sugar diet, simple carbohydrates, bread, pizza, pasta, juices, soft drinks, cookies, candies, ice cream. That have to go. Okay. Rapid weight loss. Why? The body metabolizes fat. It's caused the decreased extraction of cholesterol into the bile, cause gallstones. And fasting, decrease gallbladder movement again. Now, let's go to University of South Carolina medical website. What do they have to say? Here they are. Again, obesity, weight loss, prolonged fasting, meaning decreased motility of gallbladder. Again, estrogen we see here, hormone replacement therapy, birth control pills, and here we go. No clear relationship has been proved between gallstone formation and particular diet. So, cholesterol stones in gallbladder have no relationship to fat that you eat in your diet. Now, medical textbook, Harrison Manual, chapter number 161. Let's look what they mentioned here. Genetics, again, Northern American Indians, obesity, weight loss, female sex hormones, estrogen, age, iliac diseases, such as IBS, IBD, because they create dysbiosis, and in the small intestine, bile acids get converted into bile salt. If there is no good bacteria to do so, or there is a dysbiosis, the gallbladder stones get formed. Pregnancy, again, estrogen. Type 4 hyperlipidemia is genetic predisposition when people have a genetic predisposition to have cardiovascular events, especially males, before age 55. By the way, this group of the people who will benefit from cholesterol-lowering drugs, they will decrease mortality, I think. And cirrhosis. Okay, so again, no low-fat diet whatsoever here. Now, question, where people get this idea about low-fat diet? So here it is. I find finally a website. So it is from National Library of Medicine's Stat Pearls for physicians. Here we go. Who are going to have etiology, epidemiology? So females, again, have a higher chance because of estrogen. Native Americans, and gallstones are not common in Africa and Asia. The epidemic of obesity has likely magnified the rise of gallstones. So again, obesity, diabetes type 2, people who have a high sugar diet. But here we go on this website. I found it. Look at that. It's right here. Let me show you. Okay, here it is. A dietary consult should be obtained to educate the patient on the benefits of low-fat diet. It's not clear how they arrived to here. Don't know, but the idea is low-fat diet is not such a good idea. So now I want to go back to PowerPoint and explain to you why is that high consumption of sugar contributes to obesity, and how obesity contributes to diabetes, and actually it contributes to formation of the stones. Okay, let's go back to PowerPoint. Okay, here is my information, and here we go. Okay, so you're looking at the cell, and this is a cell from the liver called hepatocyte. So we eat a sugar, and sugar in the cell brought into the mitochondria into Krebs cycle. And the sugar is broken down into smaller pieces, and as it gets broken, it releases the energy. Energy is everything for us. We use this energy. Brain uses this energy. Red blood cells, muscles to contract, heartbeat, everything needs energy. However, if the consumption of sugar is high, that can be broken down in mitochondria, and we don't use this energy, okay, then the extra sugar get into the storage. There are two places of the storage. One is the liver and the other is the muscle. And that sugar will be used later, meaning when we don't have a sugar and we need it, for example, overnight or during the fasting, you skip the meal, you need sugar, the sugar will get released from the liver and from the muscle. However, if we keep eating more and more sugar and not exercising, not using that, here is the pathway. So it's come here to mitochondria, and out of mitochondria, this extra sugar will be converted into fatty acids. It goes right here. And fatty acids get converted to triglycerides. And liver will make cholesterol. Here we come. Here is that cholesterol in high sugar diet that in the liver ended up in the bile, and this cholesterol will create a problem. This cholesterol will, in people who have high sugar diet, will contribute to stone formation. Yeah, kidney, excuse me, not kidney, gallbladder stone formation. So this triglycerides get combined with some of cholesterol and form very low density lipoproteins, and they go into the fat. So this is the mechanism formation of the stones in people who have a high sugar diet, who have obesity, and who have a diabetes. Here it is. This is your extra cholesterol. And by the way, it's interesting here. If this mechanism get overwhelmed, formation of energy and storage is booked and totally, there is no more place to put the sugar, and you still keep eating that, then fat tissues will incorporate the glucose or the sugar that you eat together with insulin. So here is the insulin comes in here, and the sugar get incorporated into fat tissues. And as needed, it get broken again into fatty acids, and you will be forming cholesterol. And that cholesterol will go straight into the bile, and you will be forming cholesterol stones. Now, it's very important for you to understand why is that fatty diet or fat from the diet has no impact on forming stones in the gallbladder. And the answer to that is because we absorb very little fat from the digestive tract and very little cholesterol. Some medical sites, some research showed between 5 to 10%. Some are saying that it's up to 15%. Okay, but it's a rate-limited step absorbing of the fat. Liver cannot produce that much bile to absorb a lot of fat, and also pancreatic gland cannot produce a lot of enzyme called lipase to break down that fat so it could be absorbed. As a result, a lot of fat get lost. However, if you really eat really, really fatty meal, and some people do that, what happened, they develop actually a fatty diarrhea. And they will complain about that because fat will, it will be fatty diarrhea, and the fat also will create sort of a dysbiosis, and they will start to complain about gas, bloating, and then fatty stool. So before they have a diarrhea, they will have a fatty stool and a lot of digestive complaints, right? So they will be recommended eventually. They will start to cut down on fat in their diet. Okay, guys, that's it for today. Thank you very much. Like, subscribe. Bye-bye for now. Done.